Good morning. I'm Dr. Yoldas. I'd like to talk to you about meniscus and cartilage injuries in the knee. Often when we hear our friends or family talk about meniscus or cartilage injuries, it sort of is synonymous to each other, but to the orthopedic surgeon, there are some differences. So when we look inside the knee, if I move the patella out of the way, the femur and the tibia, we think of two different types of structures. One, we call the meniscus tissue. They're both C-shaped. They're on either side of the knee, the medial and the lateral side. They're sort of like little shock absorbers or cushion. On the end of the bone, on both sides, shown in blue here, represented, even though in nature it is white, is called the articular cartilage. And it is a smooth sheet of tissue over the ends of the bone, but actually pretty thick, a good 4 or 5 millimeters thick, or a good 1/4 inch thick. They both have a role to allow the knee joint to move, to flex, to bend in a smooth fashion, almost sort of like an ice skating rink. It should be sort of frictionless. Let's talk about meniscus injuries first. Through the course of either trauma when we're younger, a teenager or 20-year-old, twisting, running, jumping, etc., or as we get a little bit older, 50, 60 years old, when the tissue gets a little bit more brittle, they can crack, split, or tear. Sometimes doctors get a little bit specific about the orientation of the tear, whether it is across it, what we call radial, or along the length of it, we call longitudinal, or split top and bottom, what we call horizontal. In either case, the meniscus tissue, which is made of a type of cartilage, has very poor blood supply. Hence, it has very poor chance of healing on its own. While it's not dangerous, it can often act as an impediment to full recovery. You may start altering the way you move, altering the way you run, jump, or participate in athletic activities. If that is the case, you can talk about arthroscopic surgery to clean that torn tissue, sort of like trimming a hangnail. Of all the stuff that we do orthopedically, arthroscopic surgery to clean up a torn meniscus is rather straightforward, meaning it takes about 15-20 minutes to do, crutches for a few days, hopefully return to full activity in 5 to 6 weeks. So on the scale of intervention, on the scale of invasiveness for the patient, this is more of a procedure as compared to an operation. For the articular cartilage, a little bit different. This smooth surface, almost like the treads of a tire, can get worn out over time, the 50 to 60 years old, or for the 20-year-old young man playing football who got tackled hard, you can get a punched out lesion or a crack or divot within it. We talk about the grades of injury, grade 1 being a little softening, grade 2 having some cracks in it, grade 3 where it becomes more like crab meat, sort of fibrinous, and then grade 4 all the way down to bone. So not all cartilage injuries are the same. So discussion with your doctor is important about the extent of the injury and the location. Sometimes just rest is helpful, sometimes requiring injections for cortisone to reduce inflammation, but even now some of the role of biologic injections such as PRP or stem cell injections may help the healing. And then lastly, if there are flaps or cartilage defects all the way down to bone, arthroscopic surgery to induce healing or even graft those cartilage defects is indicated. Once again, each surgery is specialized, that if it's just a cleanup of some rough tissue, crutches for a few days, return to activity in 5 to 6 weeks. But if we are down to bone, we can grow cartilage in there using either graft material or your own stem cells, but that would take crutches for 4 weeks, no running or jumping for 3 to 4 months, and hopefully return to full activity in 5 to 6 months. So once again, while we hear the name cartilage, it does imply sort of a wide spectrum of different injuries that can allow us different methods of treatment, from simple to more complex. Thank you.